I had a chance to speak to Grand Chef Constant Ouachiche, Paul-Émile Ottawa, Chef Paul-Émile Ottawa from Manawan, where Joyce Echaquan came from this morning about their leadership role that they plan to play in highlighting the important impact of Joyce's principle, which touches in part on principles of equality, equity, and fairness towards Indigenous people who have often and still get treated as second-class citizens in what we believe in Canada to be a first-class healthcare system. So there are many facets of this. You asked a specific question about what a measure of success of this meeting is, and I can confidently say that I don't know yet. I want to give the opportunity for people to talk, to speak, for our people to participate. What I do know as leaders, when we call out systemic racism and racism in the healthcare system towards Indigenous peoples, that we can call it out, but Canadians often get frustrated at politicians that simply call things out and then don't do anything afterwards. So I think Canadians will expect concrete answers, concrete measures, and we know where some of those lie going into these. There have been many reports. You look at the Vienne Commission report that talks about the interplay of the federal healthcare system on reserve, its link to provincial healthcare systems off reserve, and how that has to get better. So, you know, there is a specific role in our jurisdiction to play. It doesn't absolve provinces and territories from recognizing that systemic racism exists. It is the lived experience of many Indigenous people on a day-to-day basis as they apprehend the healthcare system and normalize treatment that is unacceptable. So I think a measure of success is coming up with a joint plan as Canadians to hold ourselves up to the standards that we have set for ourselves, and recognize that in some respects we are failing, but we can meet them together as a country.